As Western nations grapple with the profound challenges of an aging population, the conversation often centers on medical innovation, pension reform, or expanding nursing care infrastructure. These are essential, of course, but there is another, quieter source of wisdom that the West has largely overlooked. One that is deeply cultural, quietly effective, and centuries old. It lies in the Confucian-rooted eldercare traditions of China. Despite its rapid modernization and shifting demographics, China still retains core elements of a culture that venerates the elderly, prioritizes family responsibility, and understands aging not as a burden to be managed, but as a phase of life to be respected. In a world where longevity is becoming the norm, perhaps it is time for Western societies to stop viewing aging through the lens of crisis and start seeing it through the lens of care, continuity, and community. Across much of Europe and North America, aging is increasingly synonymous with isolation. Older adults live alone at unprecedented rates. In the United States, nearly 28% of adults over 65 live by themselves. In the United Kingdom, that number is closer to 40%. While some cherish their independence, many suffer from loneliness, depression, and a lack of adequate day-to-day support. Even in wealthier nations with robust healthcare systems, eldercare is often fragmented. A web of underfunded nursing homes, overworked caregivers, and bureaucratic hurdles. The pandemic only worsened this reality, exposing the vulnerabilities of eldercare institutions and the high emotional and physical toll of separating older adults from their families. Western societies, in their quest for autonomy and efficiency, have neglected the essential human truth that aging is not merely a medical condition, it is a relational experience. Contrast this with China, where, despite urbanization and modernization, multi-generational households remain a common fixture. It is not unusual for grandparents, parents, and children to share the same home, or for elderly parents to move in with their adult children later in life. This structure is not merely logistical, it is philosophical. At the heart of China's eldercare tradition is the Confucian ideal of xiao, filial piety. This moral principle emphasizes respect for one's parents and ancestors, and the duty of children to care for their elders. It is deeply embedded in both social expectation and state policy. In fact, some local governments in China have even implemented filial responsibility laws that legally obligate adult children to support aging parents. While such policies may seem heavy-handed to Western sensibilities, they reflect a cultural norm that sees aging not as a burden, but as a shared family journey. Elders are seen not only as dependents, but as sources of wisdom, caretakers of grandchildren, and spiritual anchors for the family unit. This framework has profound implications. It fosters a sense of purpose among the elderly, emotional intimacy across generations, and a more sustainable model of care. One that is not solely reliant on institutions or overtaxed public systems. Of course, China's eldercare model is not without its strains. Urban migration, the legacy of the one-child policy, and rising costs of living have begun to erode the traditional family structure. Millions of elderly parents live far from their adult children. The government, recognizing this shift, has begun investing in more formal eldercare services, including community centers, home-based care options, and improved pension systems. But the cultural foundation remains intact. There is still a social premium on maintaining familial bonds. Older adults in China are more likely to live with or near their children, and caregiving is still primarily a family responsibility. A duty carried out not with resignation, but often with pride. What can Western societies learn from China's example? The lesson is not to copy Chinese policy or traditions wholesale. Rather, it is to recognize that eldercare is not merely a technical challenge to be solved with better funding or institutional reform. It is a cultural question about how we define responsibility, how we value age, and how we organize our lives across generations. The West can benefit from rekindling the idea of shared intergenerational living, co-housing initiatives, tax incentives for caregivers, and flexible work arrangements for those supporting aging relatives can help reintegrate eldercare into the family sphere. Respect for older generations must be more than a slogan on Grandparents' Day. Schools, media, and workplaces can play a role in cultivating positive representations of aging, not as decline, but as accumulation of life, experience, and insight. While institutional care will always be necessary for those without families or with high medical needs, policy should aim to strengthen the ability of families to care for their elders. That includes financial support, respite services, and accessible community programs that keep older adults engaged and connected. Urban planning in Western cities often isolates the elderly. Long commutes, car-dependent suburbs, and inaccessible infrastructure create social barriers. Thoughtful design that encourages proximity and interaction across generations can go a long way in sustaining the invisible threads of care and connection. Western societies pride themselves on individual rights, mobility, and self-sufficiency. These values have brought many benefits, but they can also exact a cost when it comes to how we treat our most vulnerable, including our elders. China, despite its own rapid transformation, offers a counter-narrative. One where dignity in aging is not outsourced to distant institutions, but grounded in close relationships, moral responsibility, and deep cultural continuity. It's a reminder that eldercare is not just about policy, but about values, and that the health of a society is measured not by how it treats its most productive members, but how it honors those who have already given a lifetime of service. The West doesn't need to abandon its values, but it may need to expand them to make room for a more collective vision of care and a more compassionate way to grow old.